Welcoming a new baby into the world can be a time of joy, but each woman has a different experience of pregnancy and giving birth, and sometimes there can be difficulties. Noticing the warning signs early and taking action by seeking medical help and advice can save lives. This film covers the 6 most common warning signs you might experience during pregnancy. We will begin by hearing what they are. 1. If you are feeling breathless, have a fast heartbeat, and feel tired, you may have anemia. 2. If you experience bleeding, then it may be a sign that the placenta is covering the birth canal. 3. If you are experiencing bad headaches, swelling of feet, hands and face, this could be a sign of preeclampsia. 4. If you feel shivery, cold, sweaty, or have a high fever, this could be a sign of an infection, as could bleeding or fluid from the vagina that may smell offensive. 5. If the baby is in the breech position or more than one baby is due, you should seek medical help. 6. Noticing if the baby stops moving around is also an important reason to get medical help. Now, it's time to hear from my colleague, who is going to explain how to recognize and react to early warning signs.
Anemia or weak blood happens if women do not eat enough food containing iron or something called folic acid. It also happens if women lose blood, have worm infection, or suffer from malaria. There are some easy ways to spot anemia. These are feeling breathless, heartbeat being faster than normal, and feeling very tired. Look out for these other signs of anemia too. Is the skin paler than normal? Check the palms of the hands and the soles of the feet, especially if the eyelid or tongue is pale or even white. This is possibly a sign of anemia. Another warning sign is bleeding during pregnancy. It is very important to get medical help where possible if this occurs. Severe headaches, excessive swelling of the feet, ankles, hands and face, seeing flashing lights, or having blurred vision are all warning signs during pregnancy. These can be signs that a woman has developed dangerously high blood pressure and a condition called preeclampsia. Some women also experience chest or abdominal pain and vomiting. The 4th warning sign is fever, which can be a sign of infection caused when a bacteria or germ enters the woman's body and makes her feel unwell. If a woman gets an infection, this can be very dangerous. Women with high fever will have skin that feels hot to touch. They may feel unwell, cold, shivery, or sweaty. Another sign of infection is fluid from the vagina that may smell offensive. Women that develop an infection once the baby is born may have more bleeding than is expected from the vagina. The blood may be in large clots or foul smelling. Get medical advice and help as soon as possible. Women whose pregnancy belly is unusually shaped or larger later in pregnancy may be expecting more than one baby. Or it could be that the baby is lying sideways or with its bottom rather than head down. Women who are having more than one baby and whose baby is not head down are usually advised to give birth in hospital. Sometimes a cesarean section operation is carried out whereby the baby or babies are delivered through the mother's abdomen. If the baby stops moving around as much as normal, then you should seek medical help as soon as possible.
If you experience any of these warning signs, you should seek medical help immediately. Acting as quickly as possible will help you to have a safer, healthier pregnancy and childbirth.